All right, so get this. Today, we are going deep, really deep into a topic that'll make you think twice about, well, sanity.
Oh, yeah, we're going there.
We're talking about how we, as a society, decide what's normal and what crosses the line into abnormal.
And to really get into it, you've brought along some excerpts from a study that, let's just say, caused quite a stir.
A classic, really. Rosenhan's on being sane in insane places. Still relevant even decades later.
It makes you question, well, everything.
Absolutely. But before we get lost in Rosenhan's world, let's just lay some groundwork. How do mental health professionals even define abnormal behavior?
It's more complicated than you might think, right?
Oh, way more. It's not like there's a clear-cut checklist or anything. Context, that's huge.
Right, like imagine you're chatting away with your houseplants, your roommates might start to worry.
Yeah, but what if you're, say, a botanist studying how plants communicate? Totally different story.
Exactly. And it's not just about the situation. How often something happens is important too, right? Absolutely. If a behavior is, constant and it's really messing with someone's life, causing distress, preventing them from doing everyday stuff.
And it might be a red flag.
Yeah, exactly. Gotta look at the whole picture, not just a single moment.
Right. It's like those out-of-context moments. They can be totally misleading.
No, for sure. And then you've got culture to consider, too. What's normal in one place could be, well, unusual in another.
You wouldn't want to mistake a cultural tradition for mental health problem.
Definitely not. So yeah, there's no universal definition of abnormal. It's a judgment call based on, well, a bunch of different factors.
That's where Rosenhan comes in, right?
Yeah.
He wanted to know how much of that judgment is about the person themselves and how much is influenced by, the environment.
Yeah, he was really digging into that. And the way he did it, well, pretty bold.
8 perfectly sane people, himself included, getting themselves admitted to psychiatric hospitals.
Just by pretending to have one symptom.
Hearing voices. Can you imagine?
It's wild, right? And the results were, well, pretty eye-opening.
To say the least. None of them got caught. They were all diagnosed with, various mental illnesses, mostly schizophrenia. Makes you wonder, could anyone be labeled as mentally ill just by being in that setting?
It really makes you think about how we diagnose mental illness, doesn't it?
Okay, so tell me more. How they even manage this? Who were these pseudo-patients?
Well, they came from all walks of life, grad student, a painter, even a housewife. One was even, get this, a psychiatrist himself.
Wow, really? So they were just everyday people who decided to volunteer for this?
We were told to be honest about everything, except, of course, the whole hearing voices thing.
So no elaborate fake backstories or anything?
Nope. And the voices they reported, just 3 words. Empty, hollow, and thud.
And that's all it took.
Once they were in, they acted totally normal, just like they would anywhere else.
And the hospitals, they just went along with it.
They were admitted no problem, stayed an average of 19 days, some even longer.
No way. So even though they were acting normal, the staff still saw them as mentally ill just because of where they were.
It seems that way, yeah. And get this, the real patients, they were the ones who often suspected something was off.
You're kidding? So the patients were more perceptive than the trained professionals? That's incredible.
I know, right? Some patients even told the pseudo-patients things like, hey, you're not crazy, you're a journalist or something, right? You're here to check up on the hospital.
Wow, that's both hilarious and kind of disturbing. So what happened when the pseudo-patients were like, hey, those voices gone?
Well, that's where things get really interesting. Rosenhan, he called it the stickiness of the diagnostic label.
Stickiness?
Yeah, so once you get that label, that mental illness diagnosis, everything you do gets seen through that lens, even normal stuff.
So they're basically stuck with that label, no matter how they act.
Pretty much, yeah. There's this one example in the study really striking. One of the pseudo-patients, he was a professor, just jotting down some notes, observations about the ward,
Just taking notes. Like anyone would.
Right, but the staff, they wrote it up in his file as writing behavior, saw it as a symptom.
So just writing stuff down was proof he was mentally ill.
You see how that label just colors everything? And it went beyond just behavior. Even their past experiences were reinterpreted.
Oh, wow. How so?
One guy talked about his relationship with his parents, normal ups and downs, But the psychiatrist, because of the schizophrenia diagnosis, saw it as proof of emotional instability.
Just twisted it to fit the label.
Exactly. It's kind of scary how much power those labels have, how they can distort how we see people.
Makes you wonder about all the people who might have been misdiagnosed because of that bias.
And mistreated, too, potentially. It was a big deal, this study. Really made the mental health field take a hard look at itself.
Yeah, it seems like it. So what happened to the pseudo patients in the end? Did anyone ever realize they were actually sane?
Well, they were all eventually released, but not because the staff figured it out. They got discharged with diagnoses like schizophrenia in remission.
In remission. So still labeled, even though they've been acting totally normal the whole time.
Yep. Shows you how hard it is to shake that label, even when it's based on, well, nothing.
It's kind of unsettling, isn't it?
Yeah.
Knowing that could happen. So did anything actually change after the study? I mean, did it actually improve things, the way mental illness is diagnosed and treated?
Oh, it did. It had a massive impact. For one, it made everyone way more cautious about diagnoses, less relying on just, what you see and feel, and more emphasis on, like, standardized tests and stuff.
That makes sense. You want to be as objective as possible, right?
Absolutely. But it went beyond that. See, this was the 70s. Back then, if you got diagnosed with a serious mental illness, chances are you were headed for long-term hospitalization.
Oh, wow. Like in an institution.
Yeah, that was the norm.
Sure.
But around the same time as this study, there was this growing movement towards community mental health.
More outpatient clinics, therapy, that kind of thing.
Exactly. And Rosenhan's study, it really played a role in that shift. Highlighted the potential harms of locking people away, the depersonalization, the power imbalances, the risk of getting it all wrong.
So by showing the flaws, it kind of paved the way for a more humane approach.
I think that's a good way to put it. It helps speed up the whole deinstitutionalization movement, the push for community-based care. Of course, not the only factor, but a big one for sure.
Amazing how one study could do all that. But I bet not everyone was happy with what Rosenhan found.
Oh, you bet. Big controversy in the field. Lots of pushback.
What were some of the main criticisms?
One of the biggest critics, a psychiatrist named Robert Spitzer, he argued that just because Rosenhan's pseudo-patients, trick their way in...
Doesn't mean the whole system's wrong.
Yeah, exactly. Like, he said, it's not that surprising that someone could lie about symptoms and get admitted,
Especially since a lot of diagnoses depend on the patient, describing what they're experiencing.
Right. You can't really, do a blood test for schizophrenia. And Spitzer, he also pointed out that, people with mental illness, their symptoms can fluctuate.
So they might have good days and bad days.
Yeah, so the fact that the pseudo-patients acted normal once they were in, maybe that's just, how the illness works, not that the staff were missing it.
So it wasn't necessarily about whether they were truly sane. Everyone agreed on that part.
Right, it was more about what it meant for diagnosis. Like, how reliable is it really?
And that debate, it's still going on today.
Oh, yeah, definitely. Rosenhan's study, it had its flaws. Some people say his methods weren't, super rigorous, and maybe he overstated his conclusions a bit.
But it definitely shook things up.
Big time. Made mental health professionals think hard about, misdiagnosis, the power of labels, how the environment plays a role, all that.
And we've come a long way since then, but it's a good reminder that we can't just, assume everything's perfect now.
Absolutely not. We got to keep questioning, keep learning, and keep pushing for a more, humane approach to mental health care.
To see the whole person, not just a diagnosis.
Exactly. Well, this has been quite a deep dive. Really makes you think.
It does. So many things to consider. Big thanks to you and to our listeners for suggesting this study. It's a classic for a reason.
It is. And the conversation shouldn't end here, Keep asking questions, keep listening to those with lived experience, keep learning.
And let's all work towards a world where everyone feels comfortable seeking help when they need it, and where mental health is, understood and treated with compassion.
Couldn't have said it better myself.